So hello everyone and welcome to my channel. So today we will be learning about the long head of biceps in both short and long axis under ultrasound. In order to examine the long head of biceps in short axis, what we are supposed to do, we are supposed to make the volunteer sit on the stool. Now this arm should be by the side of the body, elbow is flexed, forearm is supinated and palm facing up. So this is the position which has to be there if you really want to examine the long head of biceps in short axis. So how exactly the long head of biceps is going? The long head of biceps, it goes in this manner towards the ipsilateral ear lobule. So let us see how exactly we can identify the long head of biceps with simple tip. Now this is the shaft of the humerus. You put your probe in short axis with the aspect marker towards the lateral side. Bone in your short axis is going to be having an hyperechoic rib casting an acoustic shadow, and this will be corresponding to the inverted U alphabet. So you will be able to see one inverted U here, which will be corresponding to the shaft of the humerus because your probe is now in short axis to the humerus. Now you keep on moving up and your movement needs to be in an oblique manner, how I have already explained you. And you are supposed to go for the duplication of this inverted U. And you just stop there, and that will be the point where you will be seeing the lesser tuberosity, the greater tuberosity, and the long head of biceps in short axis. And this will be corresponding to the level of your intertubercular sulcus. So let us see the demonstration. So now I'm using a high frequency probe of 20 megahertz frequency, and I have set a depth of 2.5 centimeter because my volunteer is very lean and thin. So what we have learned, we'll just keep the probe in short axis to the humerus, right? And we will be looking for this inverted U. So this inverted U will be corresponding to the shaft of the humerus because our probe is exactly perpendicular, right? Now, how are you supposed to move? You are supposed to move your probe towards the ipsilateral ear lobule until this inverted U will become 2U. So let us see that. So I'm just moving my probe. Now this U, inverted U, I should say, has become 2 inverted U. So now this U, inverted U, has got duplicated, right? So I will freeze it here. And once you are freezing, you will be able to see one U here and one U here, inverted one. And they are joining like this. So this is your intertubercular sulcus. This is your lesser tuberosity. That is your greater tuberosity. And what you are seeing here, that is the long head of biceps in short axis. And this one is your deltoid muscle. This is the transverse humeral ligament, which will be holding this long head of the biceps in the intertubercular sulcus. So this is about the long head of the biceps in the short axis. So let us now revise what we have learned. Our probe is in short axis, okay, to the humerus with the aspect marker towards the lateral side. So from there, we are going to go up in an oblique manner until this inverted U will become 2U. And make sure your beam is perpendicular to the structure of your interest, else you will be ending up in anisotropy, like what is depicted at the center of the image. You can see now your long head of biceps in short axis is looking anisotropic to you. It is because my beam is not perpendicular. Now, the moment I am going to make it perpendicular, see, it looks like an hyperechoic cluster dot-like appearance. Now, from there, if you are learning ultrasound, for the first time, you can always make use of your index finger, right, to keep it at the center of the probe. Fine. And then you can just rotate your probe. Once you have rotated your probe like that, right, you can just go down. You can make use of your heel-toe maneuver, or you can just do the toggling. And the moment you will be just going down, you are just looking at the longitudinal axis of the biceps, right? You can just go down. You can toggle your probe. This is very much important, right? Keep toggling and keep going down. And you need to evaluate it till its myotendinous junction. So that was all about the long head of the biceps in the short and the long axis. Thank you so much.